Hello, everybody. Welcome to the first in this series of webinars sponsored by Breathe Strong America, a series of quarterly webinars we're excited to bring to you, and we're happy you're with us today. I'm Jane Martin, your moderator for this webinar, here with Jenna, our tech guru in the back of the scenes. Our guest speaker today is Dr. Ralph Panos, who, in addition to being a brilliant physician and inventor, is a kind doc with a heart for people with COPD and other chronic lung disease. He's a pulmonologist with the University of Cincinnati College of Medicine. He's worked at the Cincinnati Veterans Administration Medical Center for nearly 20 years, holding positions as the chief of the Pulmonary Critical Care and Sleep Medicine section, associate chief of staff for research and development, acting chief of staff, and chief of medicine. He developed and directed the Cincinnati VAMC Pulmonary Rehab Program for nearly a decade. He has edited 4 books and published over 100 articles, reviews, and book chapters. And he's currently serving as the Executive Physician Director of the VA National TeleCritical Care Program. His topic today is relieving breathlessness in COPD, deflating dynamic hyperinflation. So he'll get down to the nitty-gritty and explain how dynamic hyperinflation plays a role in shortness of breath and how you can get the most of the breath you have. So with that, I'll turn it over to Dr. Panos.
Oh, thank you so much, Jane. That was so kind. And thank you all for joining us on this Monday holiday. It's great to see you all and to hear the stories about Pet Buddy from Jimmy Stover. We're ecstatic to hear that. So let me share my screen. So I've disclosure that I and my colleague Essen Zafar are co-inventors of Pet Buddy, and we're co-founders of Pet Buddy LLC. So today I'd like to start with presenting a patient. This is Alice. She's a 70-year-old. She has COPD, heart disease, diabetes. She smoked about a pack a day for 30 years, but quit over 15 years ago. She retired from an office job 5 years ago, and she likes spending time with her grandkids and her dog. She has had breathlessness that's been slowly progressive, and in the last several years, it has limited her ability to perform her usual activities and things she used to enjoy. She stops while walking to the mailbox or taking her dog out for a walk. She has to use her inhaler frequently due to this breathlessness that she experiences with exertion. Her breathing tests, her pulmonary function studies, show that she does have moderate to severe COPD. She uses quite a few inhalers, Symbicort, Spiriva, albuterol is needed, and she also takes azithromycin as anti-inflammatory thrice weekly. She completed 10 weeks of pulmonary rehab over 6 months ago, but even with the pulmonary rehab, her breathlessness with activity persists. So COPD is probably one of the most common disorders in the United States. This is a map of the prevalence of COPD, and these dark blue areas, the prevalence is upwards of 15%. And the CDC has estimated that these prevalence estimates are underrepresenting the real prevalence of COPD in the United States, and that it may be as high as 25 to 30%. That's 1 out of every 4 or 1 out of every 3 individuals have some form of chronic obstructive pulmonary disease. And you can see that the prevalence is highest in sort of this mid-central area. And if you look at maps of the prevalence of smoking, this is the area where smoking was most prevalent, but it's also the Ohio, Mississippi River Valley, And this is what used to be referred to as the Rust Belt. And individuals working in this area were exposed to enormous amounts of chemical dust and fumes during the 1960s and 70s. And that, with tobacco smoke inhalation, contributed to the high prevalence of chronic obstructive pulmonary disease in these areas. So normally with COPD or chronic obstructive pulmonary disease, we think about cardinal symptoms of cough, sputum production, and breathlessness. Cough with sputum production is very common in chronic bronchitis, but breathlessness is common in all forms of obstructive lung disease. And it is by far and away the most common symptom of COPD. None of us likes to feel breathlessness, but we all do. If you remember from the Olympics in Paris this summer, those world-class athletes who are in the fittest shape they could ever possibly be were experiencing shortness of breath after running a 100-yard dash or a couple hundred meters. But they, overcame that. None of us likes to feel breathless. It's an uncomfortable feeling. And we do things to reduce that sensation, to reduce the breathlessness and reduce the concerns that it induces. So what happens is that individuals with COPD do less. They start decreasing their activities to compensate for their breathlessness. And this can lead to deconditioning, and it also leads to decreased quality of life. The less they're able to do, they're not able to enjoy things like Alice taking her dog for a walk or playing with the grandkids. There's also fear and anxiety. Breathlessness can induce quite a bit of worry, anxiety. We do things to avoid that, and that leads to reducing our activities and can lead to social isolation. Because of breathlessness, we really need better interventions that can relieve that breathlessness and improve our breath control. And as we'll see, this is the main cause of exertional breathlessness is dynamic hyperinflation. This is the spiral that we were just talking about. Shortness of breath leads to tense muscles, increased anxiety, worsening shortness of breath, decreased activities, more anxious, and this is a downward spiral. So we need to reverse that. We need to reverse that sensation of breathlessness, reduce the anxiety, reduce the concerns associated with breathlessness. So when we look at the causes of breathlessness, we always think about the lungs first. And certainly things like cough and sputum production, chronic bronchitis can contribute to breathlessness. Decreased oxygen levels, decreased oxygen at rest, decreased oxygen levels with exertion can lead to breathlessness. And then dynamic hyperinflation. And that's what we're going to be talking about for the rest of this presentation. There are a few other causes. Certainly, heart disease can contribute, either heart failure, coronary artery disease. The musculoskeletal system can also contribute. With COPD, there's actually a loss of muscle tissue that's called sarcopenia. And as the muscle tissue decreases, our strength, our ability to exert ourselves decreases and makes us more predisposed to breathlessness. And then certainly arthritis can contribute to decreased activity and breathlessness. And then anemia, decreased red blood cells can decrease our ability to carry oxygen to our muscles and cause that sensation of breathlessness. So we said that dynamic hyperinflation is by far and away the most common cause of exertional breathlessness in COPD. But how often does it occur? The estimates are that 80 to 85% of individuals with COPD have dynamic hyperinflation. And that means between 8 and 9 individuals out of every 10 with COPD will experience this breathlessness due to dynamic hyperinflation or air trapping. So what is dynamic hyperinflation? Normally when we breathe in and out, breathe in equal amount of air that we exhale. So, excuse me. So the amount of air in our lungs stays the same throughout the respiratory cycle. As we exert ourselves, we take a deeper breath in, but we don't exhale all of that air. And so a little bit of air stays in the chest. We take another breath in, it's a big breath, we exhale, and not all of that air goes out. And each time we trap a little bit of air with each breath. And then we're all of a sudden, we're breathing up at this enormous hyperinflated air trap state. And what this does is it pushes down on the diaphragm, pushes out on the chest wall, and it makes it harder to breathe. So what happens? We stop and we deflate. We exhale a little bit more than we take in, and we go step down this escalator down to our baseline where we're comfortable again. So dynamic hyperinflation is when we take in more air than we actually are able to exhale. And we trap a little bit of air with each breath. And eventually it gets to the point where we can't take any more air in. And we have to stop and deflate and drop it all down. So this is the anatomy of what's happening. Think of this blue circle as the lungs. This is the chest. This is the airway. We breathe in, air goes into the balloon and then goes back out. At rest, the amount that goes in is equal to the amount that goes out. As we exert ourselves, more air is trapped, and there's a pinch point. We pinch this airway, and there's a mechanical obstruction to flow that causes the air to be trapped in the lungs. And with strenuous exertion, the lungs hyperinflate, this pinch point becomes even smaller, and we start pushing on the diaphragms, we push out against the chest wall, and it becomes uncomfortable. And that's the sensation of breathlessness. So the cause of dynamic hyperinflation is this pinch point. One way to think about it is think about air, a garden hose, water going through that garden hose. Someone steps on that garden hose, it's a pinch point. And that pinch causes the water to back up. And that's exactly what's happening in our lungs. It's not water, it's air, and it's backing up in our lungs, causing us to become hyperinflated and expand the chest, and it becomes uncomfortable, and that's the cause of the sensation of breathlessness. So this pinch point is extremely critical to the development of dynamic hyperinflation. And this is an engineering study was really well done. They developed a model for this pinch point within the airway, and they did all types of engineering type measurements looking at airflow, pressures, but they did something I thought was brilliant. At the end of the tube, they put a camera. So this is kind of like looking right down the middle of the airway, or with that analogy to the garden hose, it's looking right down the middle of the garden hose at that pinch point where somebody's stepping on it. Think of it, we're looking right down this channel, and we're going to look at that pinch point. And these are the pictures. And this is wide open. And then as there's more pressure, we're breathing faster. Look at how quickly the airway collapses down. And this is just showing you visually what that pinch point is and how rapidly it closes down to trap the air within the lungs and cause dynamic hyperinflation. The floppier our airways are, the faster the dynamic hyperinflation occurs. Normally, airways are rigid, but with COPD, they become much more flexible and floppy, and that causes increased collapse, and we can see it here. These are more rigid airways. They stay open a little bit longer as the pressure goes up. These are more flexible airways, and you can see how rapidly they collapse. So this is a chest X-ray. For those of you who aren't familiar with looking at X-rays, it's kind of looking at a portrait, but we're not looking at the outside of the individual. We're looking at the inside, and it's as if the person was facing us. So this is the right side. This is the left side, and we're taking a look inside that individual. Structures that are very dense are white, and things that are aerated and less dense are black. So what we can see is the spine going right down the middle, and then we have the heart, the great vessels here in the middle, and then we see the ribs going down each side, and the lungs are here in the middle. They're black, right and left. And then these dome-shaped structures are the diaphragms. And there's a little bit of gas in the stomach. So this is at rest. And then what happened was this individual then took a walk, like a 6-minute walk. And then they took another X-ray. And look how the X-ray has changed. The lungs have gotten bigger. The area of blackness is much greater. The distance between the ribs is now wider. So the chest is now hyper expanded and pushing out. Those lungs are hyperinflated and they're pushing the ribs apart. And then look what happened to the diaphragms. Instead of having this nice dome shape, they're now flat. Flattened diaphragms don't work as well. They're stretched, and respiratory muscles don't like to be stretched. So that again is contributing to breathlessness. So this is a very dynamic picture of what's happening with dynamic hyperinflation. So what are the consequences of dynamic hyperinflation? We know that it causes breathlessness. It can also cause limitation to exercise. So when Alice was walking, taking her dog on a walk or going to get the mail, her lungs were hyperinflated. She's air trapping, and then she can't do it anymore. So she has to limit those activities, do them slower, or take slow, deep breaths to prevent the dynamic hyperinflation. In studies that Dr. Zafar and I did, about 10 years ago, we showed that dynamic hyperinflation is also correlated with decreases in blood oxygen levels. So as you develop worse dynamic hyperinflation, blood oxygen levels start to drop also. And then dynamic hyperinflation can have an effect on the heart. That increased pressure within the chest pushes on the heart, decreases its ability to pump blood throughout the body. And then the stretch that the lungs feel causes the lungs to release inflammatory molecules or cytokines. And those cytokines are affected in the lung and then systemically. So it causes inflammation throughout the body. Again, a negative consequence of dynamic hyperinflation. So what can we do to reduce dynamic hyperinflation? We've seen that it's a mechanical obstruction to airflow, that pinch point where it's as if, the garden hose is being stepped on. We want to open that up. And how can we open it up? Certainly bronchodilators can help a little bit, but this is very, very different than bronchospasm related to wheezing. Oxygen can help prevent the desaturation, the drop in oxygen levels that occur with dynamic hyperinflation. We can breathe in a mixture of helium and oxygen, which decreases the density of the gas, but it can make us all talk like Daffy Duck. So it's not really practical. It works theoretically, but it's, unless we all want to talk like Daffy Duck, it's not something we can really do practically. We can try lung volume reduction surgery to decrease the effect of emphysema, but the real treatment is a positive expiratory pressure or PEP. And what that does is it creates a back pressure. And that back pressure opens up that pinch point, allows airflow to continue, and decreases the amount of air that's trapped with each breath. And that's how Pep Buddy and other expiratory resistance devices work to prevent the formation of dynamic hyperinflation. So in summary, breathlessness is by far and away the most common symptom in COPD. It limits activities, but it's also a prime cause of anxiety and worry. And it's associated with this downward spiral and decreased ability to do and enjoy activities and enjoy life. The main cause of breathlessness in COPD is dynamic hyperinflation, and it's caused by that pinch point, that mechanical blockage to airflow within the air passages. The best treatment for dynamic hyperinflation is positive expiratory pressure, pursed-lip breathing, or devices such as Pep Buddy that create that back pressure, open up that pinch point, and allow air to go in and out and prevent air trapping, dynamic hyperinflation, and all of its consequences. So that concludes the talk, and I'd be glad to answer any questions you might have.
I just had a question. The situation with people who might have another cause of breathlessness, like pulmonary fibrosis, can this tool help them?
The cause of breathlessness in things like pulmonary fibrosis is a little bit different. It's not so much dynamic hyperinflation. So this device will not help with them, but it can help with some of the anxiety and breathlessness. Because what Pep Buddy does is it causes a slower breathing pattern. And as you take slow, deep breaths, it can reduce anxiety associated with breathlessness. So that may be one use of Pep Buddy in things like pulmonary fibrosis.
I guess another question I would have is if you have that pain management problem, I was wondering if you could address that, because many times it might be, like you mentioned, the person with pulmonary fibrosis might not have dynamic hyperinflation or air trapping, but that anxiety can create a cycle, especially I'm in that group that has diabetes, arthritis, and some of those other factors that I'm finding that it's very important to look at anything else in my toolkit that can help me focus on my breathing and slow down.
And then that's certainly Pep Buddy will decrease your respiratory rate and help induce slow, deep breaths. And if you think about it, that's the pattern of breathing that is advocated in relaxation breathing, in yoga, in meditation. And that's associated with decreased anxiety, decreased worry, and in part because that type of breathing stimulates the parasympathetic nervous system, which is associated with relaxation. So Pep Buddy can help you practice those meditation, relaxation breathing techniques.
My question is for the doctor. I would like to know, and I haven't tried this yet, so that's why I'm asking, can I use the PEP Buddy while I'm walking or while I'm doing exercises in physical therapy? I saw on the video where the lady was on an exercise bike.
Yeah.
I'm in physical therapy because steroids are eating my rotor cups away. So my therapy is not on a bicycle, but it's dealing with bands and ice, and he's got me doing all kinds of weird things that I thought I would never ever be doing, but I am. So my question is, can I use this while I'm doing that? I've not tried it, but it's sure crossed my mind many times.
No, absolutely. You can absolutely use it with physical therapy. We've had folks tell us that they've taken the most comfortable shower using Pep Buddy because before they were getting breathless taking a shower. They used their Pep Buddy in the shower and everything went well. They were very comfortable, and it was the best shower they'd had in years. So
Wow.
yes, please use it. Use it, taking a walk, you're out shopping. It's unobtrusive. Use it there. Use it with physical therapy. It's designed to be used at rest or with exertion, with activities.
Great. Thank you. Thank you very much. I will shoot Jane a video of me using it during physical therapy next week. I promise.
Excellent.
Sounds good.
Awesome.
Sounds good.
Have hyperinflated lungs. Do they stay hyperinflated or can they go back down?
They go back down with rest. So as soon as the respiratory rate, everything calms down, slows down, it de-escalates. So with hyperinflation, with exertion, things go up the escalator. With rest, they go back down.
So, but once you already have hyperinflated lungs, they will always expand out that far?
Well, once you have COPD and have those floppy airways with that pinch point in the airway, that's what causes it. So once that develops, that individual will always be at risk for developing hyperinflation. And it's very common, as we said, 8 to 9 out of every 10 individuals with COPD have dynamic hyperinflation.
I have a question, Dr. Panos. In regards to what Elena just asked, how long does it take or how much time doing the PEP buddy or the pursed lip breathing to make a noticeable difference? Like, is that a matter of minutes or hours, or just say that somebody, and we looked at the chest x-ray pictures, say that somebody's really maxed out to the point where they can hardly have room to get air in, then can you bring us through a little bit of how long that might take, or how much effort, or what happens?
As you've seen from Mr. Stover, that using PEP buddy is real easy. It's basically like a whistle. The effect is almost immediate, because what we're doing is inducing that expiratory resistance to create that back pressure that Dr. Zafar talked about, and that opens up that pinch point. The pinch point's open, air is going in and out, and there's no more dynamic hyperinflation. Doesn't prevent it completely, but it certainly slows down that process. So think of it as the escalator not being as steep. It's slower. It's a slower process to get there. And that reduces that sensation of breathlessness. It also increases the recovery after exercise. So using it after exercise can improve the recovery. So the effect is because it's a mechanical issue, the effect is immediate. It's not like taking a medication that takes a while to take an effect. Start using the PEP buddy, it's immediate.
I was wondering if those Zephyr valves, have they helped people quite a bit, or is it iffy?
The valves are really a treatment, not so much for dynamic hyperinflation, but for emphysema. So what the valves do is they're one-way valves. So those areas of hyperexpanded lung and emphysema become deflated. And with that deflation, there's less hyperinflation, less air in the chest. So the valves work well for emphysema. They're not really a treatment for dynamic hyperinflation per se.
We had a couple of questions in the chat. Barry is asking, where do we get the PEP buddy?
You can purchase PEP buddy. We're on Shopify. The website is pepbuddy.com.
And John was asking, does Medicare pay for it?
No, not currently. We're working on that. That's to get CME accreditation and payment is a long process, and we've only been in existence for about 2 years now, 3 years, and we've started that journey, but it's a long journey.
I would say that, and I know that pennies are really, really tight for a lot of people for sure. But given the other devices that are out there, I think that Pep Buddy is very affordable. Isn't it about $25, Dr. Panos?
Yeah, $25, $30. Yeah.
Yeah.
And then with
So
shipping.
it's really reasonable in the grand scheme of medical devices.
Well, it does three things in one. You can't go wrong by using it. I stress that to my followers every single day. It's 3 in 1. I mean, it's one of the best tools that we've been offered in a long, long time that has got nothing but positive results. It's like, how can you not want to spend the money? It's just sad that some can't. I mean, I get that. But for those that can, that are not, I just don't understand it. I'm like, wow, I am just totally blown away that the person who says they can't personally breathe, this device will make them personally breathe no matter what.
Exactly.
The back pressure, just getting the back pressure without having to go get on my ventilator. I could sit in my living room and still watch TV now. And I'm like, wow, what a relief. So there's a big plus for me. I no longer have to go jump on my APAP to get it blown out. I'm like, this device will do it. I just have to be patient and trust it. And I do. So it's a win-win. But the relaxation, I was just literally floored as a COPD patient that this device really does relax you and you don't even pay attention to it. I was blaming my morphine, and I am really close to telling the VA I no longer want morphine because the PEP buddy is doing the job. And it's like the morphine prescribed to me was for breathlessness, not for pain. Even though I wanted it for pain, they are testing me for breathlessness, and it's not as effective as this little device. I'm just shocked.
Wow.
So yeah, I'm probably one of your biggest supporters when it comes to this device, but I've been doing this for 29 years, and to finally see something that's 3 in 1, people just don't get it. It does 3 things in one. You just can't go wrong. I mean, you literally can't go wrong. And I'm sorry, guys, I'm sitting here trying to sell the PEP buddy to everybody, but I'm a firm believer. As a COPD patient, I'm a firm believer. It does the job that you guys invented it to do. So I tip my hat to both of you. Both of you gentlemen know what you're doing.
Yeah,
I wish I was in Cincinnati so I could have you as my pulmonologist, but I'm stuck in California, so be it.
Yeah, but I'm
I
still
agree.
seeing folks at the Cincinnati VA. So I still have my chest clinic there. So
There you go.
I agree with Jimmy. It's a fantastic device. Yep.
yeah,
Yeah,
it has no side effects.
No,
being-
none.
That's what's even better. There are no side effects from it.
Yeah, but let me ask, could you make it chocolate flavored in the future?
Ooh, there you go.
You know?
We'll think about that one.
Okay, you know.
Karen, I have a question for you with Pep Buddy. Was there any learning curve as far as getting used to it or reminding yourself to use it and having it be more of a bigger part of your life, or do you use it maybe just once in a while, or can you tell us about that?
Yeah, I'd have to say that I have to remind myself, Jane. I'm not as 24/7 with it as Jimmy is, but then I'm not on oxygen 24/7 at this time. I used to be 20 some years ago, but so maybe I don't feel the need for it as much. When I exercise, I use it.
Mhm.
Great.
Yeah, so maybe there's a difference in how we are using it, perhaps. But yeah, at first I had to tell myself, use it, you know,
Mhm.
and now if I'm exercising, I do use it.
Mhm,
But like sitting here, no, it's not hanging around my neck.
mhm.
No.
I think that speaks well to everybody's different. So you
Yes.
can just use it as, you can make your own dose, if you will,
Right.
and
Yeah,
just
right.
use it as how
Right.
it works for you.
Yeah, it's Jimmy perhaps needs it more than I do. My breathless, my dynamic hyperinflation perhaps doesn't happen as frequently as Jimmy's does. Perhaps. Maybe I'm lazy. I think I'm lazier than Jimmy, perhaps. You know? Yeah, so
I doubt that, but I just look, I'm like the Energizer Bunny. I just keep going. But you guys, I made a
you
deal
are,
with
Jimmy.
I made a deal with God way back in 2010. I would do everything plus one, and I would never stop talking about COPD till he takes me away. And I've tried to live up to that to this day. So that's the only reason. I just refuse to give up.
Yeah.
And I feel that if I can get up and fight for my breath, and anybody else that wants to listen to me, so be it. I mean, I'm going to go forward. Look,
You've done it.
I'm still blown away with using an upright walker. There are so many patients that are using their walkers incorrectly, and I got introduced to an upright walker, and it's changed my
Yeah.
life. It has literally changed my life. I do everything now, not by scooter, but by walker. And I'm like,
Oh,
why don't doctors realize this? This is
good,
just
good.
awesome.
Well,
Mhm.
I used a walker after I had brain surgery 2 years ago. Now, the way I use my walker is my cat jumps on it and I push her around the house.
Hey, there you go.
You know? Yeah, she says, hey, this is pretty cool, you know?
There you go.
That's
So
perfect.
this pet buddy, if say right now I'm fine, my oxygen's 94 sitting, but if I get up and I walk 20 feet to the bathroom, it drops down to the low 80s.
Ooh.
I have to, put my oxygen on to move
Mm.
around. So this pet buddy, if I had that, would I put that on, let's say, before I go walking around, or
Yeah.
how do
Well,
you use it?
in 1 out of 3 individuals who have what you have, that drop in oxygen with exertion, but at rest, their oxygen level is fine. And 1 out of 3 people with that situation, Pet Buddy actually maintains normal oxygen levels while you're walking. So we were absolutely blown away with that in our study. When we did that, the study coordinator who was walking with the patient said she didn't believe it. She thought the pulse ox was broken because the
Yeah.
oxygen level stayed the same. And without Pet Buddy, the oxygen dropped down into low 80s. But with Pet Buddy, it stayed at 92 all the way through. And what we found was that 1 out of 3, about 33, 35% of individuals who dropped their oxygen with exertion no longer needed oxygen when they used Pet Buddy.
Really?
Wow.
Yeah,
Wow.
yeah,
Wow.
that just blew us away. But it went
That's
back to that original study that Dr. Zafar and I done 10 years ago that showed dynamic hyperinflation was associated with falls in oxygen levels. So if
Yeah.
we can prevent dynamic hyperinflation, we can prevent the fall in oxygen. And it for many people that's what happens.
Yeah, because I don't want to get up. I don't want to get up and move. You know?
Yep, we got to get you a Pet Buddy and get you up moving.
Yeah, I understand, but watching the video, what it means, when it says that.
Wanted to ask one last question. I kind of wear two hats as a retired respiratory therapist as well as a patient. And one of the things that we're doing here in Central Florida in our Breathe Strong initiative is a test, treat, train model to be adaptable for these virtual pulmonary rehab programs around the country as well, and to help training if you don't have access to a formal pulmonary rehab program. And what I'm wondering is on the detection side, doctor, we had patients here in Southwest Florida last few years twice, once in a workshop and once recently in a home health setting. But would a cardiopulmonary exercise test to help differentiate whether it's cardiac, pulmonary, or deconditioning be of value?
Absolutely. There's so many individuals who have some lung disease, some heart disease, and deconditioning. A full cardiopulmonary exercise test can determine the best areas for physical therapy, for rehab. So I would strongly advocate for the cardiopulmonary exercise study to
Well,
determine
thank
the
you so
best
much.
treatment approach.
Because what we're looking at is so many people in the process in our healthcare system have difficulty getting to the right place at the right time. And one of the
Yeah.
things that we want to do is help on early detection that Dr. Thomas Petty always advocated years ago. It was the early detection part. And if we could get to you before you're moderate to severe, but you're early, but you have these other complicating factors, this Pep Buddy could really help that person stay active and exercise. And we're thinking, what can we do to help the primary care doctor work with the pulmonologist?
Absolutely. If we can prevent the breathlessness to allow people to do more, they can keep going and keep doing more. Prevents the loss of muscle tone and deconditioning. So yes, Pep Buddy can absolutely help to keep people active.
Thank you so much.
Okay, everybody. Thanks so much, Dr. Panos, for joining us here this afternoon. And it was a great presentation. I think we learned a lot
Yeah.
that we
Yes,
didn't know before.
Thank you.
Thank you, everybody, for coming today. Please make sure you visit the Breathe Strong America website. It's got a new look. Jenna did a beautiful job of updating it. And there's new information and new videos that I have contributed with some tips about different things and breathing. So thanks again, everybody, and have a good night, and we'll see you later. Bye-bye.
Thank you all. Thank you
Thank
very
you all.
much.
Take
Thank
Hi,
you,
care.
Bob.
Dr.
Hi, Dave.
Panos.
Bye
Bye-bye.
now.
Hi,
Bye-bye.
ladies. Bye-bye.